Hey everyone, welcome back to Vital Signs Vlog, your trusted source for cutting-edge health insights, wellness tips, and expert advice on tackling obesity in today's challenging world. Today, we're exploring a groundbreaking perspective on America's obesity crisis. It's not just about diet and exercise. Stress, hardship, and social factors are reshaping our gut bacteria and brain in ways that make weight management tougher. With obesity affecting about 40% of U.S. adults and costing $173 billion annually in healthcare, plus obesity-related cancer deaths tripling from 1999 to 2020, this is a wake-up call. Guiding us through this is medical expert Reilly Allmoslecher, a family nurse practitioner and clinic director at American Family Care Joplin, drawing on the latest UCLA Health review to highlight how social determinants drive these changes. Stick around as we unpack the brain-gut microbiome link, social influences, and actionable steps for personal and systemic change, because addressing root causes can transform your vital signs like metabolism, inflammation levels, and overall resilience. Let's start with the core issue. Obesity isn't solely a personal choice problem. As Reilly Allmoslecher explains, drawing from the UCLA review led by Dr. Arpana Church, social determinants of health like income, education, healthcare access, neighborhood disadvantages, discrimination, adverse childhood events, isolation, and loneliness are major drivers in obesity onset and progression. These factors create a perfect storm in disadvantaged communities, where limited access to healthy foods, safe exercise spaces, and quality care, combined with chronic stress from violence or structural racism, leads to reliance on cheap, processed foods and emotional eating patterns. Here's where it gets fascinating. The brain-gut microbiome system acts as a bridge, translating these social stresses into biological changes that fuel obesity. Reilly notes that environmental influences trigger the production of appetite hormones, inflammatory markers, and neuroactive metabolites, altering what we crave, how much we eat, our metabolic function, and even exercise motivation. Chronic exposure to unhealthy diets reshapes brain structure, reducing gray matter volume and disrupting networks for reward, motivation, and emotional regulation, while poor gut bacteria diversity ramps up inflammation, impairing self-control and locking in cravings for ultra-processed foods. Stress from racism or isolation further promotes inflammation, harming gut microbes and brain pathways, with neighborhood disadvantages linked to harmful bacteria that impair metabolism. Shockingly, these effects can start prenatally or in early childhood, setting up lifelong susceptibility. Quoting Dr. Church from the review, "Our findings reveal that tackling obesity requires more than focusing on individual choices. It demands recognizing the powerful role that social and environmental forces play in shaping gut health, behavior, and long-term health outcomes." Reilly echoes this, stressing the need for a dual approach: personalized care and bold policy reforms to improve access to nutritious foods, education, and healthcare. On the bright side, while systemic change is essential, individuals can take steps now. Reilly advises prioritizing budget-friendly nutritious foods, building social connections to combat isolation, and incorporating stress busters like journaling, nature walks, exercise, empathy practices, and gratitude. Healthcare providers play a key role too, screening for social determinants, understanding their cumulative impact, and tailoring plans to address biological and psychosocial barriers for better outcomes. Wrapping up this Vital Signs vlog on social determinants, stress, and obesity via the brain-gut microbiome. Huge thanks to medical expert Reilly Allmoslecher, FNP and Clinic Director at American Family Care Joplin, for her insights inspired by the UCLA review. Remember, obesity is influenced by more than willpower. Address your environment, seek support, and advocate for change. If you're struggling with weight or stress-related issues, consult your provider. Drop your thoughts below. How do social factors affect your health? Hit like, subscribe, and share to spread awareness. Until next time, keep those vital signs strong. Empower change from within and beyond. If you are feeling under the weather, you can walk into American Family Care Joplin 7 days a week with no appointment to get a diagnosis. We will have you feeling better and back on your feet fast. AFC Urgent Care Joplin, located off 3rd and Rangeline behind Starbucks. American Family Care, the right care, right now.